Welcome to the Daybreak with Jeff Slakey podcast. I'm so happy you found us. Please subscribe, rate, review, and share this with your circle of influence. It's a collection of the interviews, news, and conversation during Daybreak with Jeff Slakey on I-Fiber One News Radio, KMAS, weekdays from 6 to 9. Good Monday morning to you. The Daybreak Show here on AM 1030 and FM 103.3, 23rd day of November. We're just a few days away of Thanksgiving. And Spencer, how are you?
I'm doing all right. I'm still semi in a food coma after Saturday evening's delicious Thanksgiving feast number 2.
Yeah, that's right. You had some of the kids in. And so what was the spread? How was it?
Oh, it was nice. I got off work later, so I told everybody, just leave me a little bit of everything and I'll be happy when I get home. But it was a great time and lots of great food. We've been doing lately just the white meat of the turkey because nobody really gets into the dark meat, so it's kind of wasteful. So we just got some fresh turkey breasts this year and all the fixins that Sarah and my mother-in-law make every year. Good stuff.
Very nice. Very cool. Well, what's going on with the weather? You know, a lot of the times, one of the traditions of Thanksgiving is to get out there Thursday morning and with the family, maybe play a little touch football or go for a long walk. How's it look this week?
Well, I don't want to jinx it, but it looks like Thursday may be the only rain-free day of the week if it stands. It looks like it's a very little chance of rain on Thursday. Today it's going to rain until early morning, and then it's going to be partly cloudy starting around when the show ends at 9 o'clock.
Well, coming up today, this first half hour of the show from the Mason County Economic Development Council, Jennifer Baria and Karin in talking about the latest sets of news notes from the governor's office and the impact to our community. Also in the second half of the show here, Amber Shirk, who's the Community Outreach and Navigator Program Manager for Choice Regional Health Network, is on. Going to talk about open enrollment and some other things going on there. Mason County Public Health notified of 17 additional Mason County residents Friday afternoon that tested positive for COVID-19, bringing the total to 718 in Mason County. Again, do what you can this week to help limit the spread. Remain socially distant and wear your mask. Wash your hands if you're going to be going into those stores. And with the reduced numbers, just kind of take it easy and give everybody a little bit of grace this week for sure.
Absolutely. Good advice there. Health officials in the state said the number of people who are hospitalized to receive treatment for the coronavirus has reached a record high. KMAS TV reports there were 762 people receiving hospital care for the virus in Washington as of Saturday. Leaders from hospitals statewide met last week to consider strategies to ensure they have room to care for COVID-19 patients as the hospitalization rate climbs. Washington State Hospital Association CEO Cassie Sauer says the cancellations of elective procedures under consideration to make room for coronavirus patients include joint and heart valve replacements and some cancer surgeries.
Well, this story got a lot of movement on both our website and our social media, as you can imagine, over the weekend. As the number of COVID-19 cases grow, so do the number of complaints about workplaces violating the state's Safe Start masking requirements. There were 2 in the South Sound that got fined from the Department of Labor and Industries. They're one of the agencies charged with helping make sure employers are following state requirements. Complaints by workers are sent directly to LNI's Division of Occupational Safety. In addition, we're hearing also reports of customers that may call and ask. In addition to that, we're hearing reports of basically secret shoppers, too, coming in and testing. You know, we hear about secret shoppers that are underage. They go to try to buy liquor or cannabis at the stores, and this is the next version of that. So 2 in the South Sound. We heard about the Agate store fined $7,500 here. The business has appealed this one. And then in Lacey, My Good Market was fined $6,000 for not enforcing customer mask use and not taking employee temperatures. So now this is the case, Spencer, and stop me if you think I'm wrong here, but where a secret shopper will go into your place without a mask on, or maybe even just kind of half masked, to see what happens. Is that what you're assessing there?
Yeah, what I notice is it's kind of interesting, isn't it? A year ago, we wouldn't have been talking about this, but it's kind of mask etiquette and monkey see, monkey do. I've noticed that when someone approaches you, sometimes with a mask down, it's almost their way of saying, hey, I'm wearing this because I have to. I don't really believe in this. And then the other person lets their guard down. Have you noticed that? I've noticed it. People chatting together, you're either all masked up and you believe in the masks, or everyone's not wearing a mask, or they have it down at their chin. But it's almost a way of luring somebody to take their mask off. Almost like the comfort level is there. Like, okay, you're obviously not threatened by me. I won't be threatened by you. Let's take our masks off. We both personally probably think it's silly. And then wham, it could be somebody turning you in. I mean, I talked to, I won't say who, I talked to a couple of local business owners in Shelton over the weekend, and they said that this $7,500 fine and even the $6,000 for the Lacey store, that could be crippling. I mean, there's some stores that struggle to make that in profits over a year, 6 months. I mean, they don't make that kind of money. So that could be crippling to the point where they can't stay open, or they'll have to lay somebody off. So it's a very careless mistake to make, and I think people have to be careful.
Washington State gas prices down about a cent per gallon in the last week, $2.67 today, according to Gas Buddy's daily survey. Gas prices in the state are 2.5 cents per gallon lower than a month ago. Cheapest in the whole state, $2.17. Most expensive, $3.29.
The Apple Cup between Washington and Washington State scheduled for this week has been canceled due to the Cougars not having enough scholarship players available because of positive COVID-19 tests and contact tracing. The cancellation raises the possibility that the in-state rivals will not play for the first time since 1944, although both schools say they are hopeful to reschedule if an open date presents itself. There could be potential options for playing the rivalry matchup at the end of the season should neither team end up in the Pac-12 championship game.
I know. They're not going to. Nobody's playing. These schools all across are just getting dinged hard. And now if they're trying to get even just the bare minimum to make a bowl game, gosh, I hope the coaches have not decided to go for that as opposed to safety conditions. You know what I'm saying?
Yeah, no, exactly.
Seahawks are off until a week from today. They'll play Monday Night Football here on the radio. And again, coming up this first half hour of the show from the Mason County EDC, Jennifer and Karin are on the air. And then Amber Shirk from the Choice Regional Health Network stops by to talk about health and open enrollment, as Amber is a community outreach and navigator program manager. That's all coming up here on Daybreak.
From the iFiber One News Radio studios, you're listening to Daybreak.
Hey, good morning, everybody. Jeff Slakey and Spencer Hughes on the Daybreak Show. We are just on the start of a new directive by the governor for COVID restrictions, and it is impacting many industries in Mason County very hard. On Zoom video conference right now from the Mason County Economic Development Council, Jennifer and Karin, how you doing? Good to see you guys safe firstly.
Good to see you. Thanks for having us. We appreciate it.
We all kind of knew that something would be coming likely after the election was all said and done, and there are more restrictions that have been put into place. And some of the main impacts are restaurants in the area, as well as gyms and things like that. But this is, again, just another big blow to our community, who had been working so hard and as best they could to, do what they could to slow the spread. But the numbers across the state are just getting out of control. And now these businesses are facing more tough decisions.
Mm-hmm. It really is. It's going to be it sucks that it's at the holiday time as well. I'm thankful that we're not completely shut down like we were when we initially started, that there is some flexibility that our businesses have. A lot of our restaurants had started shifting to curbside and takeaway, and hopefully with some help, we can pull together partners that can really get the word out and help those of us that are still employed and able to reach out and have. I know it's easier to stay at home and to cook for yourself, but to realize that even picking one day a week to grab a sandwich from a local place or pick up coffee at your local cafe, those things can help, and they do help. And
it adds up.
Yeah. And the minimum is it shows those businesses that we are still supporting them. And so they're willing to go through the effort of either emergency loans or going through grant processes. We get so, as a business, I'm sure they get so tired of having to fill out application after application after application. And whether or not you get money, it's just a lot of paperwork to try and get some of that. So knowing that your community is behind you, I think really is what bolsters those businesses to say, this sucks right now, but we can make it through, and I want to be there.
And it's just hard.
Community too.
Yeah.
I mean, we've always come together and rallied and supported one another. And like Jennifer said, it's perfect to, even like one day, like she said, one day, pick a restaurant, pick up one thing. For those of us that are working still full time and able to do that, it'll help them through this.
It's just hard because I was talking with Jamie Mel from John L. Scott, and the housing market and the stock market are just continuing to go up and up and up. And it's these Main Street, city level, mom and pop shops that are really still getting the brunt of it. There's no help from the feds. We're not seeing any sign of help for the feds here. And the state is really kind of curtailed as well. You can't run deficits in the state, so they've got to come up with some pretty unique ways to help this out. I know you guys delve deep into these numbers when it comes to the ripple effect of stuff. So when people are able to shop local or go to a local restaurant, that money stays in the community longer than if it were to be for a kind of a national chain. And again, though, I don't want to pit a local mom and pop versus a national chain, because we know that a lot of these are franchises and they're run by local folks here in the community.
And any engagement from businesses in our area, whether or not it is a franchise, that's one of the reasons why economic development focuses on pulling in outside money into the community, because that's new money. That is an infusion into our community. Spending locally brings in other dollars to our community. So really being able to focus in on that support. And the governor did talk about, you're right in that states can't deficit spend. They have to plan for it. Federal government's a little bit different story, but I don't think we'll hear anything from them in the next few weeks. I think it's going to take a lot more time for them to decide what it is at the federal level that we need to provide in order to help our local businesses. But at the local state level, we are looking at, the governor mentioned a $50 million bucket of money. They haven't yet decided or figured out how that's going to be allocated. So I do think you'll start to see the plan for that in the next few weeks. Our local county, after the announcement, announced that they were going to add additional funding as much as they can. So they're working through the process to see how much they can add into our small business grant program that we've got right now. So hopefully we'll be able to help more businesses that have been directly impacted by this. It's not a shutdown, it's more of a slowdown, a pullback that was just announced. So it's hard and it's frustrating. And I do want kind of a own personal message is that for those that might have to go on unemployment, you might not have that extra $600, but unemployment is still there for you. Do go through the process. It can take some time and bring on that paperwork, but it is important that you realize that that is there for you to use now.
Yeah, I was just going to.
Workforce office here too, up on Mountain View. Those folks are here and ready to help you. Might be a little less stressful than sitting on the phone for 4 to 6 hours. Stop in and see them. At least get an email to them, get their contact information to help you get things started. And again, if you personal message, if you could stop by a restaurant one day a week, and even if it's, it's not something that you would do or you would normally have in your diet. I mean, pick up a lunch or a dinner for someone that maybe has just lost their job, or maybe in need, or maybe a senior in your neighborhood. And, it might help pick up their day, their week. We have to think about the echo effects that we have heard about in our joint information center meetings in the mornings with that county leadership. We have to think about mental health and looking out for one another.
Yeah, I would.
It's a difficult time.
Take this time to put a plug in to this week's Sheriff Sit Down with Chief Deputy Sperling and Sheriff Salisbury. It was a fascinating conversation just about that, kind of the outer effects of all that's happening with COVID. I know you guys have some upcoming class potentials on the horizon for folks to help shore up maybe their paperwork and things like that. How's that all looking, and what are some ideas on that?
We definitely do. Check our website where we'll have all of the information up on that. But one of the things that we've noticed as we've been working with our businesses through this process is they're prepared for a small emergency. Nobody was prepared for this size, but if there's one thing that we need, it's for our businesses to realize that there's resources out there that can help get them more prepared. The county has, before all of this happened, had gone after a grant for just this business training. We called it the Business Builder course. They've continued that. It is coming out. Karin is pulling together a group of local people here for some targeted business trainings that we're hoping to be able to launch in January. So really know that if the businesses have to shut down for a little bit and still pay their rent, there is potential funding for that. But there's also some training options that you, the business, can be doing while you're waiting for this to pass. If you're looking for something to do with your time.
Tonight, actually from 6 to 8 p.m., if you go to enterpriseforequity.org, they have the Building Your Online Presence workshop. And we have heard nothing but incredible things about those folks that took it on Monday. It's a free workshop. And now is the time that you want to build your online presence and your e-commerce, modifying your business plan. So another free opportunity.
We've become so accustomed to online shopping that our locals really need to realize that there's a way for you to still get those local dollars if you give those customers access to your product in a different way. So definitely.
We'll put the links to that from Enterprise for Equity when we do this in the show notes. Otherwise, choosemason.com has got links and COVID resources for you to learn more, not only from the business, but the worker perspective as well. Jennifer, Karin, good to see you. Good to see you're healthy and well. And
you too.
This is a time definitely for pay it forward. Remember that phrase?
Mm-hmm.
Or you pay it forward?
Yeah.
This is a good one
all
for
of
that.
Those, we just posted something from our partners at Thurston, the EDC, all of these small businesses that contributed to your fundraiser, to your sports teams, all of that. Now is our time to help them out. And
you're contributing to their fundraiser.
Yeah, exactly.
Right
now. Pay it forward, call it what you want. Kindness, it's just supporting our small business. Mm-hmm. And thank you for all of the things that you do, you and Rod.
That's good to see you. Good to see you guys. Nice to know you're well, and we'll work to get through this together.
Yes.
Yes, we will.
Thank you.
Thank you, Jeff.
You're listening to Daybreak on iFiber One News Radio.
Well, good morning, everybody. Jeff Slakey and Spencer Hughes on the Daybreak Show. I have via Zoom video conference the Community Outreach and Navigator Program Manager for the Choice Regional Health Network, Amber Shirk. Amber, how you doing?
I'm doing great. How are you?
I'm doing well. Thanks for coming on in the midst of a very fast-moving situation. We had planned to have you on to talk about some upcoming in-person opportunities for open enrollment, which is happening here soon. But of course, the governor made his proclamation this past weekend and things have dialed back, but the information is still applicable and people are still open to go to the Choice Regional Health Network website, which again is at crhn.org. There's great information there, but open enrollment, and it's just kind of a weird year.
It is kind of a weird year, but I think that it has provided some really awesome opportunities as well. Because a lot of people are starting to pivot to virtual meetings and online meetings and telephone meetings. A lot of our community members are becoming more familiarized and more comfortable with using that digital source of media. And it allows for them to do appointments in a way where they're able, in the past, not everybody is able to come into the office. And so when they call to do a phone meeting, it's really difficult to go through different plans with somebody and say, hey, do you want this one or that one? And they can't look at it and engage with it. And 2020 has given us an opportunity to be able to do things like Zoom meetings and share a screen and reach people who previously maybe weren't able to leave their home. And now they are able to get that more in-person attention. So I like to see the silver linings of it all. It has been a weird year, but I think it has also opened a lot of opportunities. And while having to cancel these in-person events is a bummer, we still have those opportunities available. And now we just need to really make sure people know how to reach us by phone or over the internet, or how to get a Zoom appointment if that's something they're interested in.
So let's talk about what would have happened at these events and how we're going to transition them to hopefully an online model.
Perfect. So what was going to happen for Mason County with Mason Health, we were going to have a tent. It was like a 10 by 15 foot tent with walls and sneeze guards and masks and hand sanitizer and disinfectant and all of the ways to keep everybody safe, but still allow people to come in person and do their applications. That's no longer happening. And so instead, what we're going to do is encourage them to contact like Alex Schiffman at Mason Health. And can I give his phone number?
Yeah, please.
360-432-7790, or Susanna Lopez. And Susanna Lopez also is bilingual and speaks Spanish. So if we have any community members out there that need assistance in Spanish, her number is 360-432-7766. So they'll be taking calls and doing applications over the phone. People can also reach out to me. My number is 360-819-7836. And I offer people an opportunity to do appointments by phone, or they can schedule an appointment and we can do it by Zoom. That seems to be a really popular choice. I also have a pretty nifty Calendly link that people can sign into, and it puts up a bunch of times and they're able to choose the time and platform that works best for them. I think that's how I made this appointment with you.
Yeah, it worked out just fine.
Curiosity.
No, it's exactly right. I went to the link and it said this time for this half hour. I said, yep, that works for me. That works for you. And so it set up just perfect. So if you and I were to do this, if we're having this conversation and I'm interested in the open enrollment, Washington Health Plan Finder, and we start talking about the deals, and you're like, well, bronze level is blah, blah, blah. Silver is, yada, yada. You're right that's kind of hard to comprehend over the phone. Are you able to then share your screen or show a breakdown of these?
Yes. And that's exactly what I do. It also helps because, going through the application, there are aspects of the application where there's like privacy policy rules and different disclosures. And it's very dense, long reading, but it's much easier to be able to just share the screen with somebody and say, do you agree to these and have you read them, and give them the opportunity to engage with them. But when it comes to plan choices, I have found that sharing the screen and being able to engage with the client is so helpful. I think it also helps to break down some barriers and gaps that a lot of times people are intimidated to use the health plan finder. You know, the system was originally set up to be a kind of like a self-help website. Like you should be able to go in there, log in, and do your own account. And a lot of people, they get in and they get confused, or they get a little overwhelmed or nervous. And so if they're able to go through the whole application with a screen share and see like how I'm entering the information and how I'm looking at like, what do they mean by that? Because, you know, different questions sometimes are worded in a way that might be a little confusing. However, there's a little hyper question mark that you can hover over, and it'll kind of put the lay terms and put it into a format that's a little more easy to understand. So as a client going through an application, really, I'm looking at the application very similarly to the way they would see it if they logged into their own account. And we can go through the whole process together, which then makes them more comfortable in the future to access their account, make their own adjustments, or do their own application in the future. Not that I'm trying to, you know, move myself out of a job, but
well, you know, as you talk about this, I'm thinking of plenty of other governmental agencies that have had issues over the last few months that would probably be real beneficial to help folks on a step-by-step basis like that.
It is. And they can see what I'm typing in.
Yeah.
See me. They can see the questions before they come at them, right? So like they already have those answers ready, and it goes a little bit quicker. And some people I even give the option like, do you want to drive or do you want me to drive? And they're like, what do you mean? I'm like, well, you could log into your account and you could share your screen with me. And then if you get stuck, I'm here. And otherwise, I'll just kind of be quiet in the background and let you process through. And some people really are excited about that because they want to do it, but they just don't want to get stuck and then have to be on hold or reach out to try and figure out how to get past the next question.
So what's the deal with open enrollment now? Have the dates and times of eligibilities changed because of the virus? I mean, is it open now? Is it open? Is it going to continue to be open? Are folks able to utilize this now or?
Open enrollment is from November 1st to January 15th this year. Generally, it ends December 15th. If you apply for if you do your open enrollment before December 15th, you'll have a start date of January 1st. If you do it after December 15th, you'll have a start date of February 1st. I believe it is extended due to COVID. However, one of the things that I've been finding is that because of 2020 and its uniqueness, there's been a lot of different special enrollment periods and not open enrollment, but just like open times. And so a lot of people who are on qualified health plans were already assisted earlier on in the year during times where things were opened up. And so they were able to make their changes or update their applications. And so while it's, steady right now during open enrollment, it's definitely not as busy and rushed as I've noticed it in past open enrollments, because people had an opportunity kind of earlier on. And a lot of the reasons that people are switching over or adjusting their accounts is because of something that was caused by COVID, which allowed them to do it like a special circumstance.
Yeah. Washington Health Plan Finder's website is wahealthplanfinder.org. The Choice Regional Health Network is online at crhn.org. And I'll put links to these in the show notes as well as we're going through this. And again, on the Zoom call right now, Amber Shirk, the Community Outreach and Navigator Program Manager for Choice Regional Health Network. And then, of course, the great folks at Mason General Hospital, Mason Health at masongeneral.com. Well, I would imagine, hopefully, maybe we'll see one of these down the road, but if not, it looks like you're navigating this very well online for folks. And it's important, super important for people to have this coverage if they haven't received it already. Amber, good to talk with you.
Yeah, thank you so much for your time. Can I give you my Calendly link as well?
how about I put that link in the show notes so people
Beautiful.
can direct click on it.
That would be amazing. Thank you.
I keep you on the call here a little longer just to enjoy the background.
Yeah, I'm at the beach, everyone.
Oh my gosh, that's how it is these days in 2020. Amber Shirk from the Choice Regional Health Network. Thanks for coming on.
Thank you.
Thank you so much for listening to today's Daybreak with Jeff Slakey podcast. Again, I'm so happy and honored you found us and chose to listen. Please subscribe, rate, review, and share this with your circle of influence. It's a collection of some of the interviews, news, and conversation during Daybreak with Jeff Slakey on iFiber One News Radio KMAS, weekdays from 6 to 9. Thank you so much again, and talk with you next time.